Okay, now?
Now.
All right. Let's get it right this time. My head's starting to hurt.
All right.
Now, why are we hanging upside down again?
Because a lot of people have a view of the dentist that we want to flip upside down.
Ah, that makes sense. It's kind of corny, though.
It's kind of corny, but it's truthful.
Yeah.
When they come to Miller Comfort Dental.
Yeah, blood rushing your head, it's hard to say, isn't it?
And, yeah, Miller Comfort Dental. It is harder to say, but it's fun to say.
It's Miller Comfort Dental of Lakeville.
Actually, you should try this upside down at home. It's really a lot of fun to say.
Yeah. Okay. So you had a question for me. What was it?
So my teeth don't hurt, but how can I have cavities?
Okay, that's a real common misconception. By the time a cavity gets big enough to hurt, it's probably not going to be treatable with just a filling. It's probably going to be something more involved, like a crown or a large filling, or maybe even a root canal.
And what is... Yeah, I don't even know if I want to ask. What's a root canal?
Okay, a root canal. Buzzwords, scary words, the thing that the comedians and the sitcoms play with all the time. People conjure up pictures of 3/8-inch variable speed Black & Decker drills. It's really not that complicated. Root canal treatment, as we call it, is actually one of the most common and one of the most successful procedures we perform in the dental office. And when done well, it's successful 96-97% of the time. So what kind of car do you drive, Jorgie?
Mercedes.
Mercedes, nice car. So 100 people drive a Mercedes, 96 people drive a really nice car, 4 people have lemons. Who do you hear from?
Lemons.
Well, of course, and 3 out of those 4 people, if they had their car serviced and did what they were supposed to do, they probably would be satisfied. So 1 out of 100 are dissatisfied. Well, that's about the same with a root canal. The only people you hear about with bad root canals are people that waited too long to have it done. Okay, what is a root canal? Inside of each tooth, there's 1 root, 2 roots, or 3 roots, and inside of each one of those roots, there's a canal or a tube that holds the nerves and blood vessels to that tooth. When that tissue is damaged or diseased by bacteria or trauma, we can go in and remove that, sterilize the tooth, and seal it so that your body's immune system says, hey, this is a tooth, it can stay here. Then we put a large filling or a crown in there, and you can keep that tooth the rest of your life.
When you're hanging upside down, does a root canal hurt more?
Right now, I can't tell you if my root canals hurt because my head hurts so bad it's making me think of other things.